Hi, my name is Jane. I'm the lead physical therapist here at Alliance Urology. I've been a physical therapist since 1990 and working in pelvic health since 2015. We're going to have a quick conversation to help you understand why your physician has scheduled you to see a pelvic floor therapist prior to your surgery.
My name is Deborah. I'm a physical therapist assistant, and I've been working at Alliance Urology since 2013. Much of my caseload are patients undergoing prostatectomy. Today, Jane and I are going to go through some common questions that you may have.
What is a pelvic floor, Deborah?
Your pelvic floor are the muscles in the bottom of your pelvis that play a big role in supporting your body in every move that you make. Those muscles also help to support your organs, including your rectum, bladder, and prostate. There are three very important muscles down there that help with male continence, so it will be important for you to be able to find and use those muscles effectively after surgery for a swift recovery.
Why do I need to attend therapy before and after surgery?
As your physician has discussed, after robotic prostatectomy, it is common to have urinary leakage and erectile dysfunction. It's been shown through several studies that seeing a pelvic floor therapist before and after surgery helps you return to continence quicker. Our job is to help you get back to your regular function as soon as possible.
You keep saying continence. What does that mean exactly?
Continence means keeping urine in the bladder. Incontinence means urinary leakage. Leakage after surgery can range from just a few drops to large losses of bladder control, depending on several factors. This part of your urinary system works just like a garden hose, with the urethra being the hose that's bringing out the urine. On the inside of the bladder, there's something called the bladder neck and the internal urinary sphincter. That's just like the spigot on the house. Usually that thing is either on or off. The prostate, that's acting like somebody putting a kink in that hose or somebody stepping on that hose. It's providing more resistance. These muscles down here are just like the sprayer on that hose. Most men prior to surgery are able to stop their urinary stream. That's your sprayer. Of course, after surgery, the prostate's going to be removed, so we've unkinked that hose and shortened it. The internal urinary sphincter, that spigot on the house, is going to be on part of the way or all of the way after surgery. So all you're going to have left is this little sprayer down here, and that's where we come in. For you guys, the muscles in the pelvic floor are not something you're familiar with, so it takes a little time and practice to be able to find and use those muscles effectively.
How often will I be coming to therapy and how long does it last?
Each appointment lasts about an hour. Before your surgery, we'll have an evaluation with one of our trained therapists. We'll assess your overall strength, teach you how to contract your pelvic floor muscles the right way, and give you some easy exercises to start performing at home. We also spend a lot of time explaining what you can expect after surgery and discussing other modifiable factors that can affect your leakage, like fluid intake. After the evaluation, you'll return for 1 to 2 more visits prior to surgery to make sure that you can perform your exercises well, and so we can give you even more information. We are here for you. We also have pelvic ultrasound available, which will help you find your muscles more proficiently. After surgery, plan on seeing your therapist at about 4 weeks and then again around 6 weeks post op. We will check on your leakage, your incision sites, and start some new exercises that are aimed at getting you dry and getting you back to your regular activities as soon as possible. Our focus will be strengthening, helping you to learn how to control the incontinence, as well as providing support and advice for erectile difficulties. From that point, we schedule based on individual needs, so how long you remain in treatment depends on your level of leakage.
Do I need to wear anything special for my PT appointments?
Not for the first visit, but please bring all the questions you have. We do recommend you come at least 15 minutes prior to your appointment time to make sure that you can find a parking space and check in at the kiosk. Prior to surgery, we'll start with simple exercises so it doesn't really matter what you wear. But after surgery, you'll want to wear something a little bit more comfortable to exercise in because we're definitely going to get you moving.
I read online that I'll need to have an internal assessment.
No, don't believe everything you see online. We will assess your pelvic floor muscles through your pants initially. You may be required to partially disrobe for ultrasound, but that is performed externally.
Can I bring a family member?
Yes, we love it when the wives and partners come. They will be an active part of your recovery, so they probably have a lot of questions for us as well. We know that they love you and want the best care for you. It's always good to have an extra set of ears because we do provide you with a lot of information. We are part of the team that wants to get you better as soon as possible.
Please let us know if you have any other questions prior to your initial evaluation. Our phone number and contact information is listed on our website. We look forward to meeting you soon.